and start soon with my brief introduction.
Should I play the instrument, the slides now, or just wait after your
Yeah,
introduction?
just wait.
Okay.
Okay, thank you. Hello, everyone, and thanks for taking the time to join us with today's webinar. This is Amy, and for today's webinar, we'll have a lecture by our speaker, Dr. Marino Sutedjo, and it will last for about 45 minutes. If you have any questions, you can write in the comment section. The speaker will answer the question for you. Now, let's get started and welcome the speaker, Dr. Marino.
Thank you, Amy, for your introduction. So, good evening, everyone. So, welcome to this webinar sessions supported by Fanta. It's been an honor and pleasure for me to be able to share with you today about the topic that I like, which is the endodontic. And today, I'm giving you a webinar with the title of Less Complexity and More Control, Rethinking about Root Canal Preparations. And my name is Marino Sutedjo, and I'm from Indonesia. So nice to know you. And I don't know in your area, but it's evening in Indonesia. It's 9 p.m. So I hope you enjoy and concentrate on this short session of the webinar. So if you are talking about the endodontic treatment, we all know we have three phases of endodontic treatment, which is first thing we have to do the access cavity, and then we have to continue with our root canal preparations, and then we're finishing with obturations, and of course, last but not least is the restoration. And tonight, I will going to speak about root canal preparations to all of you by root canal preparations and the definitions. We know root canal preparations is to preparing. So it's a procedures involving to prepare a root canal systems prior to the obturations. So if we are talking about root canal preparations, it means we are talking about shaping and cleaning. Because in order root canal to be obturated, we need to do our shaping, we need to do our cleaning. By mean shaping and cleaning and the rationale behind it, we know that in most of the canals, if they are not shaped, they cannot be cleaned because the canal is too small and the irrigants cannot go in. It means we cannot clean the root canal systems. So first thing first, we need to create our volume by doing instrumentations in order to shape the canals. And after the volume is there, the final shape is there, then we will use our irrigants to clean all the root canal systems. So the rationale of the root canal preparations is always while the one who shapes and create a volume, and irrigants will follow after to clean all the root canal systems, to remove all the bacteria, to remove all the necrotic tissue and some vital tissue that is necessary to be cleaned out before the obturations. So there is actually the rationale between the root canal preparations. But today I'm going to speak about the shaping the most and not the cleaning. And if you want to do our root canal instrumentations, it means we need to have an idea of what is actually the design of the objective of shaping, like what Schilder told us and teach us many, many years ago. And I do believe the one that he taught many, many years ago, it's still applying until today in the modern era of endodontic treatment. And what he said about creating a design objective of the shaping, first thing is to create a funnel shapes from the access cavity to the apex. And if it's funnel, it means we have a good shapes of the canal. It means we have a cross-section diameter that should be narrower every point apically. So it will be like a cone shapes of root canal systems. It means if you have a cone shape like this, it's very easy for the irrigants and easier to them to reach at the apical and to clean the apical part of the root canal. And then if it is also a funnel shape, it means that the root canal preparations should flow with the original shapes of the canal curvature itself. And it's not changing the positions of the apical foramen. And last but not least, what Schilder also mentioned is about the apical foramen should be kept as small as practical. He is not mentioning as small as 25 or as small as 35. He mentioning as small as practical, because every root canal systems needs their own considerations about what kind of final shapes that we want to apply on those root canal systems. So let's talk about actually the endodontic instruments that we usually use to shape our root canal and to create adequate volume for the irrigants to work. And if we are talking about endodontic instruments, there are three topics that I want to discuss with all of you shortly and briefly. First thing about what is actually the materials update of our endodontic instruments. We need to rethink about these materials. And then what type of motions that there is nowadays we have in these modern endodontic instrumentations. And should we still to maintain the dentinal preservations? Because if you remember back in the old days, for me, for example, when I was in the dental students, they taught me to shape our root canal system until, for example, like a 45 to 4 to 50, using a stainless steel K file, which is the 2% taper. It means that we will sacrifice the apical part of the root canal system's worsening, and we don't create a good resistance form of the root itself, because we are sacrificing more at the apical part area and not to maintain the dentinal preservations. So today, what is actually the materials update of our endodontic instrumentations? And then what is actually the type of motions that nowadays we have in mechanical instrumentations of our endodontic instruments, that we have to think about which one is safer, which one is best for me, which one is suits for my hands, and then how can we still preserve our dentinal tooth structure and not to sacrifice the part that we need to save more. So let's talk about the materials update. And for this, I just want to have a quick history of our instruments. If you see the history of our instruments, we all starting with 2% stainless steel instruments. Either you are using K file, at that time reamer, headstone file, but the material is the same, which is the stainless steel instruments. And the stainless steel instruments at the time we use in the many movement, which is, for example, like a step back, like a crown down technique, like a balance force technique. But we know for sure these stainless steel instruments, they also have some limitations. In which I mean limitations, if you try to bend this K file number 15, it can be bent, but it stay in the original position, and you can see how stiff is this file. Although some of you mentioning, no, the stainless steel file have its flexibility, but it's only applied on the files that made of stainless steel file with a very small size, for example, like 6, 8, or 10. But even that, if you try to bend it, you still feel the stiffness. And can you imagine if you try to insert this kind of file in this curvature of this kind of curvature, it's very easy for us to get a high risk of ledging, of creating some elbow, creating some apical shape and some eccentric in the shape, and we might also change the curvature and change the precisions of the apical foramen. So therefore, the material at the time, we know that the stainless steel files is not giving us too many advantage. And then we arrive at the late 1990s or maybe the early 2000s. We have the instruments that we know it's a nickel titanium era. In this nickel titanium era, we have gained more advantage comparing with the stainless steel. It has a higher flexibility and it's also have a higher resistance. And not to mentioning, it has a better reproductions of the original anatomy compared with the stainless steel files. It is also much less working time because it's less sequence comparing with the stainless steel files, and also less associated mishaps in terms of creating deviations of the root canal shapes. But although we gain advantage from this night tie, but we have also disadvantages from this nickel titanium files, which is we know that this nickel titanium, it has a memory shapes properties, which is what is by mean memory properties. For example, this is a night tie file. If you try to bend it, it's a very flexible, but if you release the tension, it will go into its original position. So you can imagine why orthodontists love to use night tie, because it can back into its original position and maintaining a nice curve of the jaw. So same things also happen with our instruments, endodontic instruments that consist of 𝗟𝗍. You can try to pre-bend it, but it will be bendable. But once you remove it, it will go back into a straight position. It means they try to fight back into its original position. So can you imagine if you have a curve like this and you insert the 𝗟𝗍, they want to try to be straightening. So that's why even though we have a good advantage and more advantage with 𝗟𝗍, some of you might happen we using the 𝗟𝗍, you have an enlargement at the apical area because the file will try to straighten up even though you can put it on the curvature of your root canal system. So let me discuss first about what is actually the 𝗟𝗍. 𝗟𝗍 actually is a nickel titanium. Nickel in this case is responsible for the stiffness and the rigidity, and the titanium is more with the flexibility. But not just about the material, which is nickel and titanium. 𝗟𝗍 itself, it has two phases. First phases we call the martensitic phases, and then second phases we call it the austenitic phases. What happens if the fast is in the martensitic phase? Usually martensitic phase, it's happening if the file was in the cool temperature. So if, for example, you have a 𝗟𝗍, and if you cool down the temperature of the 𝗟𝗍, it will become on the martensitic phase, which is at that phase, it will become more elastic, but it will has also easily to deform in its plastic deformations, and it is on the cool side of the temperature. But if you heated this 𝗟𝗍, it will changing for the martensitic phase into the austenitic phase, which is in this austenitic phase, they will have a rigidity and they don't have any plastic deformations. And at that time, it will on the warm side of the 𝗟𝗍. So what the interesting part of this 𝗟𝗍, we can try and we can play this temperature by cooling down or heating up these instruments, and they will have different phase. So therefore, nowadays, we know the materials, many endodontic instruments, if it is not all endodontic instruments that is coming in this modern era, they are all made of the heat-treated 𝗟𝗍 alloy. What it means by the heat-treated, before they are making it into an instrument, they put some treatment with the heat, with the temperature of this file. So they will call this file as a martensitic phase, but it's also have a good austenitic phase. So therefore, this will eliminate the disadvantage of this 𝗟𝗍, which is a memory shapes. So Fanta, it has many types of heat treated, which is the latest heat treated that they have in this in the rising file systems. It is called the Pro Wire. As you can see, this is a heat treated. So when I try to bend it, it will not go into its straight positions. It will stay like this. Even I try to curve this file into an S-shaped curve, this file will stay in an S shapes and they will not go back into a straight positions. So it will give us advantage if we try to work at a severe curvature. It will not go straightening. It will still keep and maintaining our root canal systems and not to have many deviations of the root canal systems. So therefore, nowadays in this material update, we have to rethink about the instrumentations. If we want to have a better and more predictability with our instruments, we should try to select the heat-treated material. And I'm quite pretty sure if it is not 90 or maybe 99% of it is not 100%, the instrument stations that coming up in the market recently, they are all made of the heat-treated material, because we gain more advantage compared to the old 𝗟𝗍 and the classic 𝗟𝗍, and especially also with the stainless steel file. So now let's discuss also about the type of motions. We know in this modern era, we have four types of motions. First things, we call it the continuous rotations, which is the instruments will rotate fully 360 degrees in one directions, and usually it's the clockwise. So it keeps going like this. And the second motions is we call it the alternate reciprocations, which is there will be an equal angles of clockwise and the counterclockwise motions. and usually less than 90 degrees. So for example, 30 degrees clockwise and 30 degrees counterclockwise, just like a watch winding, but it will be in the mechanical, which is in the engine. And the number three of motions is, we call it the rotating reciprocations, which is several movement of the alternate reciprocations, but they are modifying the angle. One angle is larger than the other, so it can be the clockwise angle is larger than the counterclockwise, or the counterclockwise is larger than the clockwise. But for sure, it is not the same angle between the clockwise and the counterclockwise. And nowadays, we have also some motor, some engine that they will combine the motions, which is could be the combinations of continuous rotations and rotating reciprocations. We have heard about the TFA adaptive. We also heard about the OGP. We also have about the OTR. It is something that combine these one of two motions into one specific motions that call it usually the combined motions. So this for movement is nowadays is the type of motions that we have in this modern era if we are talking about the mechanical instrumentation instead of the manual one. So let me give you some idea and some explanations. This is what is continuous rotation. So it has a 360 degrees full rotations clockwise. And then secondly is the alternate rotations, which is the same angle between clockwise and the counterclockwise. So it's go back and forth with the same angle. And we also have the rotating reciprocations, which is the counterclockwise, and the clockwise is not the same. It could be clockwise bigger than the counterclockwise. Also, it could be counterclockwise bigger than the clockwise. And then usually the combinations of the one of two motions, for example, this is an OTR, which is the combinations of continuous rotations and follow with the rotating reciprocations. So it means they are combining two motions into one motions that is usually we use in some complex cases. So what is actually the characteristic of these continuous rotations? It is 360 degrees rotations. And you know, if it is 360 degrees, it means you have a tendency to have a screw-in effect. But at the same time, it is easier to reach the working length because it goes deeper by itself. We don't need to push that hard. We just need to just give a little push and let the file code just follow the path. And it's easier for them to extrude the debris coronally because they are going into in apical direction by itself. But at the same time, they also have a higher risk of fracture because it's very easy for them to have a torsional fatigue and also a cyclic fatigue. So what is actually the alternating rotations? Alternating rotations, for example, let me give an example of the 30 degrees angle. So it means it's a 30 degrees clockwise continuing the 30 degrees counterclockwise. And if it is rotating like this, it means they have a no screw-in effect. And since it is not rotating, it means it's more difficult for them to reach the working length. We need to push, we need packing motions, and also it might have a create more debris that more tend apically if we are not be careful with cleaning the debris every time. And there are no binding, and they have also have a less risk of root canal fracture. And since we have continuous rotations and also we have alternating rotations at that time, in year 2007, there are a big breakthrough in endodontic instrumentations. And what is caused by that is the preliminary study that has been conducted by Professor Ghassan Yared at that time. I think all of you know who is Ghassan Yared. And in the year of 2007, he has a preliminary study using a single file technique concept at that time using a ProTaper F2, but he is using it in the reciprocating motions instead of the continuous rotations. So, well, actually, this reciprocating is come with the balance force idea. You know, balance force is clockwise. If you have resistance, you put it counterclockwise to cut. So, in the balance force technique, basically, the movement that cuts the root canal, it's not the clockwise, but instead it's the counterclockwise. Because they are thinking about the counterclockwise is the phase, is the angle that is not danger and not make the instruments breakage. So therefore, some study also supporting this, but because the results that indicated that instruments, if used with the alternating rotations, it have a higher number of usage which is they have more lifetime comparing to the continuous rotations. So by this study, Ghassan, he has introductions, motions that we call it rotating reciprocations, or let's say, let us call a reciprocations motion or reciprocating motions. It is actually the modification from the alternating rotations, which is the clockwise is smaller than the counterclockwise, and it's still easier to reach working length compared to the pure alternating rotating, because it's still reaching 360 degrees after several movement of the alternating rotations, because the angle of clockwise is smaller than counterclockwise. Better in bringing the debris coronally comparing to the alternate rotations. So therefore, reciprocating, in my opinion, they try to combine the good side of rotation, continuous rotations, and also the good side of alternating rotations into one motions that we call it reciprocations. So as I told you, the idea from the balance force, because clockwise usually is more danger, it's related to the binding into the canal, and counterclockwise is safer. Therefore, in reciprocating, usually clockwise is smaller and then counterclockwise is bigger. And when they are doing the counterclockwise, it is the time they are cutting the instruments, they are cutting the wall of our root canal system or root canal surface wall. So why we should apply, or why we should trust these reciprocations? Because from many study that I'm sure all of you also heard and know about, this study that has been conducted a lot in some indexed journal, that the reciprocations will improve our cyclic fatigue resistance of our instruments. They also have less risk. They also eliminating the skewing effect, and they creating also less canal transportations. For example, like in this study from Journal of International Endodontic Journal back in 2010, they said that the movement, compared to the cyclic fatigue, the reciprocating movement will extend the cyclic fatigue of the F2 pro-taper instruments, comparing if they are the same instruments in the conventional continuous rotations motions. So we all know this reciprocations giving us more advantage at the time comparing to the continuous rotations. But I want but I just want to give also warning, not just a good side, but what about also not the good side and some doubt side of this reciprocation motions. Therefore, let's try to discuss it one by one. What is actually the let's say not the good side of reciprocations? We heard about the apical debris extrusions. So some study mentioning that using these reciprocations, we have more apical debris extrusions comparing with the rotary instruments. Therefore, tonight, let's see some studies about this and how we can react and how we can respond into this issue. There has been a study also from Gustavo de Deus in 2010 that they see there is no significant difference was found among the debris extruded between the conventional sequence, which is the rotations, and also the reciprocations. This is also a very nice study in IHE 2011. They are comparing the average debris score at the coronal part, the middle part, and the apical part. Let's go in the apical part. You see this two side reciproc, and wave one is the reciprocations motion, and on the left side is the rotation motions. And if we see the score number at the apical part, which is the yellow one, well, actually, reciprocations motions, it is slightly, or if it is not almost the same with the rotations. So therefore, from this study, they are saying that actually, if you are comparing several angulations of reciprocations and continuous rotations, well, actually, the movement were not associated with the more apically extruded debris in the reciprocation motions. So instead of worrying about more apical debris extrusions using the reciprocations motions, we now know that some study, not just one, but more studies said that there is no significant difference with continuous rotations and also with the reciprocations. I think it is more technique dependable rather than just motions and design. So you have to understand, if you want to use the reciprocations, it means it is reaching 360 degrees after a few alternating rotations. So maybe you want to make sure you stop frequently to clean the debris at your instrument's flute and make sure there is no binding and there is no extrusion. That is, in my opinion, how we should apply and how we should react with this issue. And also, there is another issue that we should also doubtful about creating a micro cracks, because some study they are talking about the incidency of the creating of an apical of the micro crack of the root if you are using the reciprocating motions. So let's see what is actually the studies mentioned about this. We know also from the Journal of Endodontic in 2019 that the root canal preparations comparing with the XP endoshaper, the reciproc blue as the reciprocating, and the pro-taper universal at the time as rotations, you know that all instruments can create a micro crack with the same incidence. But interestingly, what has also been studying also by Tadeus at the time, it was in 2019. Well, actually, the study that comparing this kind of motions, they need to extract the tooth first and then they will do the shaping. And in fact, the questions, because the small number of good teeth without any endodontic treatment, they will have also a micro crack because of the extraction impact, not because of the instrumentation. So therefore, we still not 100% sure, and I'm not going to say that reciprocations create a micro cracks, but I'm going to say it's comparable between the continuous rotations and the reciprocations. I mean, in my opinion, they both have the same chance of creating a micro cracks. So therefore, back what the Schilder always mentioned to us, just maintain as small as practical. If we think the volume is there, we don't need to make it larger in order to create more risk in creating the cracks. But one thing for sure that I think most of us has to be agree in one thing, that the reciprocations will create less instrument separations because it enhances the fracture resistance of the endodontic files. So therefore, if you are looking at the instrument's fracture, we know that fractures can be happening into two causes of problems. First thing, it can be caused by a flexural or let's say cyclic fatigue, and it's also caused by the torsional fatigue. So the explanations of cyclic fatigue is that when you try to bend this file several times, it will reach the cyclic fatigue, and then the file will break because it reaching the flexural fatigue because of too many times the uses of several times. But in torsional fatigue, it's this differently. If there is some impediment in some or part of the instruments and there is still rotations, you can see it means they have a plastic deformity, and at some stage they will have a breakage. So these two type of causes of instruments fracture, let's talk about how we should apply and how the reciprocations motions answer about this. About flexural and cyclic fatigue, we can see from the journal, from the literature, and from the study, they are comparing the same instrument, which is the pro-taper F2 in rotations and reciprocation motions, and they all agree that the reciprocating movement will extend the cyclic fatigue of the pro-taper F2 comparing with the rotations. This is also from 2012. The instruments on the left side as the reciprocations, they are comparing the continuous rotations and the reciprocations motions. The time of failure, you can see continuous rotations time of failure is 163 seconds, while the reciprocating motions, it can reach more than 2 times, which is 357 seconds before it breaks. And also, if you are comparing the mean cycles of fracture in continuous rotations, it's also higher, almost double with the rotation, with the reciprocation motions in terms of the mean cycles to fracture. So therefore, due to cyclic fatigue, we have to be agree that reciprocations motions, because it will not works too many times, it will also increase the lifespan and the cyclic fatigue of the file. And what about the torsional fatigue? The study that has been done by Yared, That's repeating engagement of the canal walls. It will stress the instruments, it will increase the torsional fatigue, and it will also create a fracture. So we have to understand that every instrument can break and every instrument has their elastic limit. By elastic limit, if there is some movement of the file and there is some impediment in the some area of the instruments, then the elastic limit has been reached, then the file will break. And how reciprocations respond to this kind of torsional fatigue, we know by making it reciprocating, it means the angle are never reaching the elastic limit of the instruments. Therefore, when they try to have a elastic limit, the file will go into the counterclockwise motions. Therefore, this file will have less risk of torsional fatigue because it never passed the specific angle that can reach the elastic limit of the instruments. So therefore, if you are talking about the good side, which is creating less instrument fracture, I have to be agree, and I think we all have to understand because of the motions they will try to avoid, and they will increase the cyclic fatigue resistance and also the torsional fatigue resistance. And not to mention, these reciprocating motions also have a good ability to remove 𝗥𝗲𝘁𝗀, as has been studied by Mario Zuolo in 2013. In 𝗟𝗲𝘀𝗀, they are comparing with three type of files, which is using the case cleaning and then the stainless steel file, and then using the M2 retreatment files, and then using the reciprocating motions to reduce the 𝗥𝗲𝘁𝗀 inside the root canal filling. And you can see the time needed to remove it is way faster achieved in the reciprocations motions comparing to the others. So now why we should think about the reciprocations is because it's a very great technique considered in a good challenging cases, because it needs us only a shorter learning curve. We always simplify the sequence, less screwing effect. We also have less torsional fatigue. It will also enhance the cyclic fatigue resistance, and it still have a comparable debris extrusions with the continuous rotations, and it also can reuse in retreatment to remove the 𝗥𝗲𝘁𝗀. So today I have a privilege to introduce you about the 𝗟1 Mini. It's a reciprocating instrument system from Fanta. And the rationale behind this 𝗟1 Mini is actually a reciprocating motions file, which is a 30 degrees angle of clockwise and 150 degrees of counterclockwise. So the clockwise is smaller and the counterclockwise is way bigger. As if you can see here is a S-shaped cross sections, and the blade is working on the counterclockwise direction, not in the clockwise direction. It starts with the first file, an orifice opener with the tip 19 with taper 5%. Usually it's to open up the orifice, and then the first shaper to be used is the 17th with the taper 04 with the white color on the handle, and the maximum fluid diameter is 1.1. And good things, it can be used both in reciprocations and in rotations. But you have to understand, since it cuts in the counterclockwise directions, if you want to put it in the rotation motions, you have to put it in the continuous counterclockwise motions and not the clockwise motions. And then after that, we can continue with the other file, which is the red one, the 2506. And it is usually I stop at this 2506 because in some cases I might need to make it larger, but 90% of my instruments I will stop at the 2506. And this is the cross sections, which is a double S cross sections. It will create high cutting efficiency, and it will also create more empty space for debris removal. So last but not least, let's talk about the dentinal preservations. What I mean by dentinal preservations is that we should have a minimal flaring that it connected the coronal part of the tooth and the apical part of the instrument of the tooth. And the 𝗟1 Mini system is also adapting this type of minimally invasive. They try now to reduce the maximum fluid diameter to only up to 1.1 millimeter at the biggest area at the coronal. Why this is important? Because they just want to preserve the pericervical dentin area What I mean by the PCD is the 4 millimeter above the crestal bone as the 4 millimeter below the crestal bone. Why this PCD area is so important? Because this area is very good area that considered to be the most susceptible area to receive occlusal force to increase the fracture strength of the tooth. The function of this pericervical dentin area is to responsible to transmit the occlusal forces to the root and also to the ferrule, and it will also play a critical role in order to maintaining a long-term survival of the tooth. So let's see then about the impact. If you are trying to make an access at the coronal part, try to reduce as much as practical the coronal part of the access cavity. And then the radicular apical preparations is try to conservative approach as minimal as possible, as practical. That's why she will always say as small as practical. And if you want to create a canal flaring, make sure we create a minimal flaring that connecting the coronal to the apical part. And there is also the answer that the R1 mini kit has been given us. They try to make only the maximum flute diameter of 1.1 millimeter, and they will also creating the regressive taper of the instrument, not to have a progressive taper. So by mean regressive taper, it has a tapering down to the coronal in order to reduce as much as practical the area of the pericervical dentin. And the combinations of the R1 mini kit is also a good match with the iRid Pro, the engine from Fanta. As you can see, you can change the settings into the 30 degrees of angle clockwise and 150 of the counterclockwise to be used with the R1 mini kit as a reciprocation motions. So I'm going to close my webinar with sharing a case that I hope you might interesting with this case. So it is a retreatment case. Patient came with this maxillary first molar. You can see there was an untreated canals at the mesial, huge area of the palatal canals, and there is also some quite big lesions in the mesial root. So this is when the patients came. I tried to open the composite restorations on the coronal part, and soon as I reaching the down area, you can see there is also uh, some possibility of maybe some miracle mix at the time. The combinations of alloy and alloy powder and the glassinomer cement. So I try to remove these restorations by using my high-speed burr. If you have difficulties with the visibility, try to reduce your water, or you can also try to turn off your water of your handpiece. Or you may try to use it alternately off and on with the water. But in order to gain visibility, I try to reduce my water spray and try to scrubbing the restorations and not just push, so we are not destroying the floor of our pulp chamber. So I try to clean the cavity from the remaining old restorations material. I put my sodium hypochlorite just to clean up the cavity. You can see how it enhanced the cleaning of the cavity, so I can have a better visibility to check the anatomical considerations in time. I'm using also a long shank, low speed tungsten carbide burr just to clean the remaining cement, the remaining sealer, and to open up some, to create some troughing and remove some covering dentin that I need to remove in order to find more suspicious about the additional canal. Once again, I put my sodium hypochlorite over there and clean it. You want to flush it, and immediately what you can see, this is the MB2 and this is the MB1. So we definitely can see the MB1 and also the MB2. One of the instruments I like to remove the remaining gutta percha on the wall of the root canal wall is also this instruments. I really like to use it, the Kura spear, just to remove the gutta percha on the side of the wall. As you can see, it's very convenient to removing the aperture that's stuck into the root canal wall. And then I try to sculpt with my K file. And I try to click it with my apex locator just to check whether I can get the patency and determine my working length at that time. You can see the hearing of the apex locator. So I try to lowering down the reference point. So I know now I want to ship my MB2. This is the L1 Mini 1703. And then you try to packing motions one up until it reach the reference point. You can see it's reaching up. So you can see the debris, and then irrigate and flush it. Put again sodium hypochlorite as a lubricant, and then you want to continue with 2506. You can see the motions of the rubber stop. It is reciprocating motions, which is what I can say also the rotations reciprocations. And then and continue to also to shape the other canal. And this is the distal buckle with also the L1 mini kit 1704. Make sure you reach working length and you want to get out, because you don't need to repeat it many times. And then you can continue also with the 2506 until it reaches working length. You can see how good in removing the remaining gadapacha inside the root canal wall using the reciprocation motions. Make sure you irrigate nicely. And then you want to check with your apex locator whether I reach my working length so you can hear it. So now I'm reaching the working length, and I want to reduce my rubber stop into my reference point. And then now I continue to ship with the L1 mini kit with the 1704 up to my reference point. Use irrigate frequently and make sure you clean the debris, and then continue with the 2506 until also the reference point. You want to continue only one time, two times is enough. You can see the debris at the apical part of the instruments. And what's so interesting, you can see here the palatal canal. I don't know what it looks like here. And it looks like a fiber post, or it looks like a composite resin. So I don't want to remove it first. I try to skip it on the side. And you can see how dirty is this one. You can see here all is black covering my L1 mini kit. And when I flush it, you can see how black is the my ingredients after flushing it the canal. So I try to continue it again with 2506. But I feel something, it doesn't make sense, because I feel there is some huge area in there. So after I finish with my L1 2506, I try to irrigate using a copious of irrigations. And you can see here, this is that I want to remove. And here I'm using again my long shank low speed carbide burr, which also you can also using the combinations of using an ultrasonic tip, for example, like this, just to make sure you remove that. And if I remove this, you can see there is some remnants of, it looks like some fiber post, the fiber post, so it's out. So well, actually it's a big palatal canal that the previous dentist might put some post, but you can see here the remaining gadapacha down there, it's still there. So I need to continue to clean and to remove the remaining gadapacha. I'm using again my instruments, what I call the Kurap spear, and then in combinations using with your ultrasonic tape, and then with the sonic activations to clean up. And then in this case, I'm using also the additionals of laser activations, assisted irrigations, just to make sure I can blast the smear layer that covering the dentinal tubule at the time, just to make sure I have a cleaner canal. So this is after all the shipping. This is the MB1, MB2, distal buccal, and the palatal canal. And then after I open up the palatal canal, you can see now it's a one big giant canal of the palatal. And then this is after obturations. And this is also post-op after I do my obturations. You can see two separate 𝗍𝗍𝗀𝗃 1 and 𝗍𝗍𝗃 2 canals, huge palatal area at the coronal part and in the middle part. And this is the 12 months follow-up. Now you can see the lesions at the mesial root is getting smaller. And if we compare, on the left side is the pre-op, on the middle one is the post-op, and on the right side is a 1-year follow-up. So once again, take-home message from this today webinar: simplifications actually improve the consistency. And in this modern endodontic mechanical instruments area, we are moving towards some simple preparations concept. And we have a better control and less procedural risk, and reciprocations motions usually help us to minimize all the necessity factors that can cause a file breakage. And I think the future of canal preparations is not just more complex, but it's more simplified, which is a better control and a smarter design of instruments. And when instrumentations become simpler and it's more control, it means we can rethink about what time that we should focusing on more on cleaning the systems and more on the biology of healing. So thank you once again for your attention. I hope there is something that you can learn from these sessions of the webinar. And thank you once again for Fanta for supporting this event. And I will see you next time. And if you have any sum of questions, I will be happy to answer some of your questions.
Okay, dear Dr. Marino, and there are two questions on the comment section.
Okay.
The first question is, for narrow canals, what is the best circulation system?
Well, I'm not going to say what is the best in narrow, because sometimes it differs when individually. But of course, reciprocations motions always be also a good choice for narrow, because in narrow canals, reciprocating motions will reduce the risk of having a more cyclic fatigue and torsional fatigue because of the counterclockwise motions with the reciprocating motions. So I'm going to say it will be safer if you put it in narrow canals in reciprocation motions. But I'm not going to say it's the best, because in the other opinion, or maybe some person might have more gain more benefit in the rotations because they are getting used to more with the rotations. But I'm going to say it based on your questions. I think reciprocations motion will be more suitable and give us more advantage in narrow canals compared to the continuous rotations motions. That will be my answer.
Okay, thank you, Dr. Marino. And for the second question is, what is the preferred movement when bypassing broken tools with
Okay.
rotary files to minimize friction?
Well, in order to bypass a broken file, I'm going to answer the best still with manual files. So because in bypassing, we need to feel our tactile sense, that we need to feel where is our bypassing file can bypass the broken file. So in my opinion, if you ask me what is the best file to bypass a fracture file inside the root canal systems, I'm going to answer it still with the manual files. Either we can use the C files or the C plus file, or maybe the C pilot file, which is something stiff and can cut more efficient comparing with the K file, but not with the mechanical files, because with the mechanical files we cannot feel the tactile sense with our hands. That's the important part.
Okay, thank you, Dr. Marino. And
My pleasure, Amy.
yeah, okay, that's all for today's webinar. And thank you so much. And thank you all for coming for the webinar. See you next time.
Thank you.
Thank you. Okay.